Hello, everyone. I'm Dr. Mahesh. I am the president of MSART for the term 2024-2025. On behalf of MSART, I extend a warm welcome to all of you for joining us today for this webinar. This webinar is co-organized with Nvwa Technology. Incidentally, Nvwa actually stands for Goddesses of Fertility. So we are actually in very good hands today. Now, before we dig deep and start the webinar, I'd just like to take this opportunity to give you some updates from MSART. Our annual conference will be held from the 5th to the 6th of October in Sunway. And this year, our theme will be looking within to grow beyond. So basically, what the scientific committee headed by Dr. Navdeep and Dr. Praveen, what they want to do this year is actually for us to kind of take a step back to reflect, try to audit our own practice, our workflow, both in our clinic, our nursing care, and our IVF labs, and then try to integrate the new ideas, innovations, and advancements, and also the evidence we have that we are getting every day. So this will be a 2-day conference. We will have 16 CPD points. And as usual, we'll have a panel of expert speakers who will be giving us insights into all the latest. So I'm sure this will be very useful for all of us, doctors, embryologists, and nurses. And it will be a wonderful opportunity for us to meet our old friends, make new connections, and of course, learn new things that will ultimately benefit our patients. So from time to time, MSART will give us updates as we make more progress in our preparation. And in our upcoming webinars, we will be updating you on any new information regarding the conference. Now, going to the agenda of today. Today, we have a talk by a very eminent speaker on epigenetics and embryo growth. Now, as we know, pre-implantation DNA methylation screening is a relatively new technique that is being investigated for embryo selection in IVF cycles. We are all very familiar with PGDA. In PGDA, we're looking at the chromosome numbers and genetic abnormalities. Now, PIMS goes a step ahead. What it looks at the methylation patterns that resemble as closely as possible to a healthy embryo. And this, in theory, should give us more information on the overall embryo health and also let us know the potential for implantation. So in practice, it should improve our practice and again, benefit our patients. So without further ado, it is my great privilege to introduce to you Miss Tian. She's a very highly qualified embryologist with more than 20 years of experience. She works in the leading IVF center in Malaysia, TMC Fertility Center, and she has overseen more than 20,000 cycles of IVF, of which about 5,000 have been PGS cycles. She's also one of the first senior embryologists in Asia to get the ASHRAE certification. Ms. T will be giving us an overview of the science behind PIMS, and also we will be able to focus our attention on how we can use this new technology in our practice to improve our IVF success rates. So, Ms. T, It's now your turn to give us your talk. Thank you.
Thank you, Dr. Mahesh. The pleasure is all mine. Okay, I will start sharing my screen now. Everything is working right. Okay, so thank you everyone for joining us this evening. Thanks for being with us today, and I hope that what I'm going to share with you is going to give you a entertaining night. Okay, so today I'm actually the title that was given to me is actually on epigenetics and embryo growth, and I would also like to share with you a new discovery, a new perspective in IVF selections with pre-implantation methylation screening. So this is the overview of what I'm going to discuss later. So I will just start with the introduction to epigenetics. So epigenetics, let's just start with the definition. What is epigenetics? Epigenetics is a study that we looks at the changes in chromosomes. These changes doesn't cause any alteration in the DNA sequence. It only changes the phenotype, and this phenotype changes can stably inherited to the offspring. The words epigenetics actually says it all. The words epi in this epigenetics actually come from Greek language. The meaning of it is actually above. So it actually spells it out because epigenetics phenomena is actually above, on top of genomes. It overrides the information that's carried by the genomes. The best example is actually on identical twins. So those who are at the same age as me probably will know these two girls. They are the Olsen twins that appears in a lot of Hollywood movies and also drama series. So this was a picture taken when they were aging about 4 and 5. So you can see they looks like quite identical to each other. They are identical twins. But look at how they looks like now. I think you can still tell that they are siblings, but they are not so identical anymore. So what happened? This is actually the best example of epigenetics changes, because when an individual grows and develops, the epigenetics changes happens in response to the environment. It could be due to stress, diet, or behavior, toxins, and any other factors that will change the gene expression. And because every individual go through different kind of, life, so the epigenetics changes that happen to each individual is actually unique to itself. That's why the identical twins starts to look less and less like each other. So how does epigenetic modification happen? There are various ways it can be achieved, either through DNA methylation, histone modification, non-coding RNA, and chromosome structure change. So in all these methods that's involved in epigenetic modification, the DNA methylation and also the histone modification are in relatively better understood. And these are the two that I'm going to focus slightly in my following presentation. Now, before we go with the epigenetics modification, let's just go back a little bit, one step backwards to protein synthesis. Let's revise this. So why do I jump from the topic of genomes suddenly to protein synthesis? Because proteins are the active player in most cells process. Protein synthesis is the final stage of gene expression. Any changes in gene expression will ultimately cause a change in the type of protein that is being synthesized as a result of it. And as the end result of it, once the proteins is changed, it causes a series of changes in your cells, and thus, in the end, brings about the changes in the phenotype. So let's just quickly revise how protein synthesis should be happening. So our double helix, DNA helix will just have to open up at a certain stage, and then the polymerase, the RNA polymerase is going to stick to it and starts the process called transcription, where the RNA will be produced. And this RNA, once completed the process of transcription, it will move away and enter into another process called translation. And in this translation process, proteins will be synthesized using this template that is brought about by the RNA. Okay, so we already know that in reality, the chromosomes, when they are in a quiet status, they are actually tightly packed into this X type chromosomes. But when it comes to the parts where the protein synthesis needs to happen, the gene expression needs to happen, the DNA will have to open up itself. Before this, they are nicely coiled up in these histones, the protein called histones, they are nicely coiled up and packed together. But when the gene expression needs to happen, this histone will change their forms and it will start to open up and starts to expose the DNA, make it accessible. And that brings us back to the epigenetics modification. So how does DNA methylation actually cause changes in epigenetics? Well, because when the DNA helix open up like this, you can see these methyl groups. Once this methyl groups is actually attached to this DNA strand, it actually stops the transcription. No transcription can actually happen when the methyl group is still attached to it. And as a result of it, when a gene is methylated, the transcription process is blocked. But once it is demethylated, when the methyl group is actually removed, then the DNA is actually opened up for gene expression. Another way of modification that can happen is the histone modification. So like we have discussed just now, the DNA, when they are not in use, they are not active, they are actually tightly packed. The histone will form an octamer like this, with the DNA being surrounded by it, coiled up like this. And the methyl group again is happening here. It attached to the histone and caused them to tightly pack together. And again, no transcription can happen. There's also a situation called acetylation. When the acetyl is binding to the histones, the DNA is going to loosen up and open up. And in contrast, when the acetyl are removed or moved away from the histones, they remain in a tightly packed situation and no DNA transcription can happen. So human beings, embryos, actually go through a critical period of epigenetics reprogramming when they develop from the gametes into the blastocyst stage, and furthermore into the uterine cavity when the embryo is trying to implant and form a fetus later. So because they are going through critical periods of epigenetics programming, a lot of things is happening here. They have to wipe away the existing epigenetic modification that they inherited from the parents, wipe it away, replace with the new modifications, and both the gametes and somatic tissues of the embryo will have this take place. So because when this reprogramming is actively take place, they are very susceptible, sensitive to changes. So any unfavorable external factors will disturb the process. That includes the parental lifestyle, maybe they are stressed, or any type of diseases that's being experienced during this period of time, and also external environment factors, which includes the environmental factors that is being induced by us who carry out the IVF process during this time. And that brings me to the next discussion topics, the epigenetics changes that is related to ART. We already know that a lot of risk of adverse experimental outcomes is actually related to IVF. That includes fetal growth restriction, preeclampsia, preterm birth, low birth weight, increased risk of congenital abnormalities. And we all want to tell the patients that the IVF babies is no difference, they don't have any particular risk, but the truth is not. IVF is related to increased risk of all this adverse outcome. Initially, we thought it is actually caused by multiple pregnancy, which is unique to IVF treatment, or maybe the cause of infertility is causing all this. But more and more evidence are being showed up now when people are doing less and less multiple embryo transfer. We are already transfer a lot of single embryos. More than 90% of our embryos transfer are actually just single. So we have ruled out multiple pregnancy, and there are a lot of studies that actually took away the bias caused by cause of infertility, and they found that the risk that is associated with IVF is still there. So they can only come to this hypothesis that it is something process that we carry out in IVF that is causing phenotypical and molecular changes in these embryos. You see, these studies that is reported in 2022, the groups try to look into the risk of genetic and epigenetic alterations in children conceived following ART. Because epigenetics reprogramming is particularly susceptible to environmental conditions during pre-conceptional period. When they are at pre-conceptional period, when a lot of things are happening, they are very susceptible. And a lot of things that we do in IVF, including ovarian stimulations, the fertilization, the manipulation, embryo culture, cryopreservations, gametes transfer, and all those things have potential to independently or collectively lead to epigenetics dysregulations. That brings me to one question that I would like to just throw to my colleagues out there. I know a lot of us are having 100% exit policy. I think it makes sense for us to always come back to this policy every now and then, knowing, remembering that the potential epigenetics changes risk that it is going to cause on our embryos. We already know from studies that abnormal DNA methylation will lead to abnormal developments. You see from here, the wild type is developing nicely into this nice embryos. And if there's any modifications to the DNA methylations, the fetus will grow up abnormally. There's also these studies that looks at the zebrafish early embryos. They found out that the methylomes is also inherited, and it's the sperm methylome that's being inherited and not the oocyte DNA methylome that's being inherited. So they come up with this suggestion that aside from DNA sequence, DNA methylome can also be inherited, which indicates the potential effects of epigenetics, which may be having some effects on the evolutions. And also, these groups, Wang et al., have carried out the same studies on the same observations on mammals. They found that the paternal methylome are at least a significant proportions of maternal methylome go through active demethylation during embryo development. So we need to always bear this in mind when we are carrying out our IVF process, remembering that any changes that we have induced could have caused some effects on the epigenetics. I would also like to highlight the incidence of recurrent spontaneous abortions. This is a pain in the neck for all of us working in IVF. When patients have recurrent when they have spontaneous abortions, they come to us asking us what happened. Why did my embryo, why didn't they sustain? A lot of times we will tell them, look, it might be because of the embryo being an aneuploid, they're not normal. But actually, if we look at the studies that actually zoom into all the spontaneous abortions, we will find out that actually 40% of the spontaneous abortions has nothing to do with abnormal cryotypes. Close to half of them actually are having normal cryotype, but still, they go through spontaneous abortions, and this cannot be explained. This is particularly painful for those patients who went through recurrent spontaneous abortion. It happens again and again to them. And a lot of times, I think 50% of the time, we have no explanation to give them. How to explain to the patient about the cause of miscarriage when we don't even know the answer? And that leads people to start to look into epigenetic changes, because we already know that in early embryo developments, and when it comes to trophoblast cells invasions, maintenance of the uterine immune tolerance microenvironment, and uterine spiral artery remodeling, all those things that happen when the embryo is actually trying to invade and implant itself into the endometrium, it is actually controlled by a complex network of genetics and epigenetics modification. So it is not surprising that more and more observations are being done and reported that actually abnormal epigenetics modification like DNA methylation defects could be the reason of multiple recurrent miscarriages and recurrent miscarriages. And it is not just related to the mother or the mother's body. Some people even this research even reported that DNA methylation defects in some spermatozoa of the male partners could actually contribute to the experience of recurrent pregnancy loss as well. And I would also like to bring your attention to genomic imprinting and imprinting disorder in ART. So what is genomic imprinting? Genomic imprinting is a phenomena in epigenetics. In genomic imprinting cases, only one copy of a gene in an individual is being expressed, while the other copy is being suppressed. So you either have this particular gene that is being chosen to express inherited from your father or your mother. So if the father's genes are being chosen to be expressed, the mother's gene will be silenced, and vice versa. Imprinting disorder happens when this phenomena fails to work. So in normal situation, it should be that only one copy of the genes is being expressed. But in the case whereby both copies of these genes are being expressed, when one of them is supposed to be suppressed, or both are being suppressed and none being expressed, that is when you have your imprinting disorders. Are imprinting disorders more prevalent after human IVF or ICSI? Well, the answer seems to be yes, because this French national health data has shown that the incidence rates of imprinted gene disease was 1.4% for those infants that are conceived naturally. But in IVF infants, it increased to 3%. Now, 3% may look like a small number to us, but when it actually happens to a family, the 3% becomes 100%. It is a struggle, and it is distressing for any family to have to cope with a child that's having congenital abnormalities. And there are very good evidence with this meta-analysis that shows that ART is certainly associated with multiple imprinting disorders. That includes Beckwith-Wiedemann syndromes, Angelman syndromes, Prader-Willi syndromes, and Silver-Russell syndromes. So babies suffer from all the syndromes. They will have, the struggle is through their life. They were born like this, and they will have to live with it for the rest of their life. So these are the sad incidents that could happen to the IVF babies. And that brings me to this new perspective of embryo screening. So before I go to this method, I would like to just share with you the clinical pregnancy rate that we are observing in TMC fertility. You can see the blue bar are the pregnancy rate we are achieving with patients that is using PGTs. And those patients who are not using PGT are shown in orange bars. So we are relatively happy with this outcome. Of course, my doctor wished that it's 100% all over, all of them, but that is not realistic. Okay, so, but still, we are still always troubled by these questions that why are those euploid embryos? They are euploid embryos, less than 35 years old patients. Still about like 25% of them are not getting a pregnancy despite having a good embryo, and the ploidy status is euploid. And more so, we are still seeing pregnancy loss from this PGT group patients, although they are significantly lower compared to the non-PGT group, but they are still there. Patients fail to understand, you told me it is a normal embryo, and why I still have miscarriages. You see, this study that is being carried out by Lee et al. In 2017, they actually looked into 59 blastocysts and found out that DNA methylome is actually potential biomarker in blastocyst selection. Because when they look into the blastocysts with different gradings, the AA, of course, being the best one, and then the B grade and the C grade, they actually found that the methylation levels is different. And by checking the methylation levels in this embryo, they can actually also use this to establish the ploidy status. They can actually differentiate the euploid embryos from the aneuploid embryos, and they can even point out which chromosome is actually having problem. It was indicated that global abnormal methylome reprogramming after occurs in human embryo and suggested that DNA methylome is a potential biomarker in blastocyst selection in ART. So this group carried out a clinical study using patients who already have PGT indications. More than 800 embryos are tested from 102 families. And 90 out of 160 PGT cycles produce live birth, and 57 cycles fail in pregnancy. 13 cycles has the pregnancy lost. So with PIMS, they actually found out the live birth rate is 72% for embryos that has methylation levels in between 0.25 and 0.27. Live birth rate is greater than 60% for embryos that has DNA methylation level between 0.22 and 0.29. There seems to be a difference. The embryos are divided into different groups according to their global methylation level, and they found out that embryos with methylation level in 0.25 even to 0.27 has the highest potential of creating a pregnancy and also the highest chance of getting a live birth and the lowest pregnancy loss rate. The overall distribution of methylation levels is similar regardless of maternal age. You can see from here that when the patient is less than 38 years old or when the patient is more than 38 years old, the methylation level is actually similar. So the same methylation level, global methylation level as a reference can be applicable to both advanced maternal age group and young patients. And that leads to the development of PIMS, the pre-implantation methylation screening, which aims to detect first, chromosome aneuploidy, second, methylation level, and also imprinting genes disorder, and potentially differential methylated regions in one platform. They have shared this case with us. You can see from here, the case number, patient number 5. This is a patient with 4 ovarian reserve. She only have 4 embryos that's going for a PGT. And out of the 4 embryos, 2 embryos is reported with euploid. The first embryo is being transplanted, but the pregnancy result comes back as negative. You can check here that you can see from here the methylation level is way below the 0.25 that we have shown just now. And this is embryo number 4 is slightly closer, although still lower, but luckily this one produced a normal life. Another case that we can see from here is a patient with recurrent implantation failure and pregnancy loss. She has 5 embryos going for PGT, and then 2 of them again being deployed. The first one is being transferred, but end up with the pregnancy loss. You can see here 0.34 is the methylation level, which is much higher than the 0.27 we have shown just now. And then, yeah, the pregnancy resulted in a loss. And the one that is slightly lower, 0.3, actually gives a live birth, a normal live birth. This platform also claimed the potential to identify imprinted gene defects. The standard methylation patterns of ICR are established according to embryo with healthy live birth. So they establish a normal pattern, so-called normal pattern, using healthy live birth, and anything that is going out of the normal range could be identified as defects, and they actually successfully identified this problem is H19, which is related to Silver-Russell syndrome. DNA methylation defects that can be identified by PIMS, including Angelman syndromes, Prader-Willi syndromes, and interference with each other, and form a complex regulatory mechanism. I just want to share with you TMC's experience. We have gone through verification with this group, and then we have the first at first stage of what we wanted to achieve is actually to verify the concordance rates of PIMS compared to our standard PGTA results. And the next stage, we would want to look into the association between global methylation levels and ERT outcome. We also like to look at the detections of abnormalities at imprinting control regions or the detection of imprinting disorder. And if possible, we also like to apply this on recurrent spontaneous abortion group, but that will be the next stage. So at this moment, we only went through the first stage. We used the discarded embryos donated by patients who had PGTA previously with the MC Fertility Center. And at this moment, we are seeing a 90% status concordance. That means whichever embryos that we have previously identified as being euploid are also being identified as euploid with PIMS. And if we identify it as being aneuploid, PIMS is also getting the results in 90% of the time. We do have 10% of discordance, but this 10% all happens on mosaic embryos. And we already know this problem with MSART embryos. They give different results even if you are trying to run them on the same platform. When you're having biopsy on two different regions, you will still get different results. And coincidentally, the embryos are being reported with mosaics by our routine PGT-A results, but being called a euploid by teams. So we put the question marks over here. This embryo potentially salvageable with this new technology, or would it actually end up with problems if we transferring them? And this remains to be seen. So as a conclusion here, techniques utilized in ART, it affects epigenetic marks in the fetus and also placenta. Possible cause for the increased risk of adverse outcome associated with IVF, including recurrent implantation failure, imprinting disorders. There are associations between methylations and implantation. Pre-implantation methylation screening provides a new perspective on embryo selection. We have a reasonably good confidence rates with current PGT-A platform. With this new platform, we are quite optimistic that it may help to further enhance the selections of the right embryo with the best chance of giving rise to a healthy live birth and not just pregnancy. We hope that it will in the future answer some questions, give some answer to our patients with multiple failure. That includes those with recurrent implantation failure, why your implant embryo is still not implanting, or those patients with recurrent spontaneous abortion.